I want to touch on a topic that is quite confusing for people in regards to anxiety. When is it normal anxiety, and what actually can be an anxiety disorder? When we worry about paying bills or landing a job, or if we have broken up with our partner, or if there's any other important life event that makes us worried or a bit anxious, that's quite normal. However, if you have constant and worries that are not substantiated by anything, but cause you significant distress and also interfere with your daily life, then that's definitely on the disorder side. And, you might need to look into talking to a trusted health professional. Another example is, we feel embarrassed or a bit self-conscious in any uncomfortable or awkward social situations. That's normal. A lot of people feel that way. However, if you are avoiding social situations for fear of being judged or for fear of being embarrassed or humiliated, and if you do this constantly, so you're missing out on situations that would actually be positive, because you're afraid of being in a social situation, that's definitely much more serious. And when we have normal case of nerves like sweating before a big test or a business presentation, if you have a stage performance or any other significant event, so that's quite normal that we get nervous and a little bit uncomfortable. But then there are other situations when people have seemingly out of the blue panic attacks and are actually preoccupied with the fear of having another one. So that's not normal anxiety. That's definitely on the side of a anxiety disorder when this happens a lot. For example, what's quite normal is a realistic fear of a dangerous object, a place, or a situation. Clearly, if we go hiking and we encounter a bear, yes, I would say that's a realistic fear. To see a bear while you're on a hike. On the other side, if we have irrational fear, or we avoid an object, a place, or a situation that actually poses little or no threat of danger. So it's really just a perceived fear, but to us it feels real because we can feel severe anxiety in our body. However, because it's not really a situation that poses a threat, that's definitely on the disorder side. One more example would be if we have anxiety, sadness, or have difficulty sleeping, for example, right after a traumatic event. Of course, everyone would say that's quite normal, that we're anxious and experiencing those symptoms. But then, on the other hand, if you have recurring nightmares, flashbacks, or emotional numbing related to a traumatic event that maybe occurred several months or years before, that is clearly then more serious and also would warrant a visit to a trusted health professional, psychologist, or even just start out going to your GP and have a talk about that if that's what you're experiencing.